and welcome to this morning's espresso shot for this week. I hope everyone's doing well. So let us begin now. Let's do this by placing our awareness in the area of the heart, taking slow, deep, gentle breaths, and then experiencing these breaths flowing in and out of our hearts. As soon as you place your awareness in the area of the heart, you begin to become more resilient. Your stress levels drop just by placing an awareness there. And then when you begin to breathe like this, slow, deep breaths, and just experience those breaths flowing in and out of your heart, your stress levels drop even more. So just do this practice for 5 minutes by placing your awareness in the area of the heart, and then taking slow, deep, gentle breaths. Experience these breaths flowing in and out of your heart. Slow, deep, gentle breaths. Keep your awareness in the area of the heart. And drawing these breaths symmetrically. That means that if you take 5 seconds to breathe in, take 5 seconds to exhale. Wonderful. Thank you so much for joining me again this morning. That was 5 minutes of practice. We're going to now talk about our topic of the day, and it's things that make me go, hmm. Today's topic is building trauma resilience. There's a corpus of literature out there around building resilience in general, and HeartMath has done some work around that as well. I want to share with you that there are 4 domains of resilience. In each of those resilience, and it's not important we don't get into those 4 domains, but each of those resilience requires one to push our bodies through, or our mental state through, or our ability to tolerate others through a process of going to the edge of our abilities, pulling back, and then uh, taking another, pushing the envelope continually without breaking, without us breaking. So for example, we'll take one domain of resilience. It's called physical. In the physical domain of resilience, when people begin to build muscle, for example, they're working out in the gym. What they do is they lift weights, and they do repetitions to a point where their arm fatigues. At that point in time, they're tearing muscles. It's quite painful when you exercise that way, but you know that you're doing it to a point where your body gives out, but you're not going to break, and that's the balance. Then you take a couple of days rest, and then you come back to it, and then you keep doing it, and it becomes easier and easier. Then you increase the weights, and that's building physical resilience. It's because you have to go to the edge of that physical envelope. When we talk about trauma, we apply similar principles. Now we're talking about emotional trauma here. We apply similar principles. And the principle we apply to this is when we are experiencing an emotional recollection of some past trauma, what we need to do is sit with that emotional recollection, sit with that emotional feeling until a point where the emotional feeling is beginning to overtake us, but we have to balance it out so that it doesn't overtake us too much. We feel it enough that we know that we can blast out of that. So this is like building muscle. So we experience the emotional trauma just enough, and then we begin to do the practice that we are about to do next, is when we start taking the slow, deep breaths, experiencing this flowing in and out of our hearts, and then begin to experience regenerative emotions. So what we're doing is we're now taking that as far as we can to experience the pain of that emotion, but then bringing in the techniques that we learn here, and try and build that another layer of muscle to be able to be able to handle that emotion, and take a day or two rest. And then when 2 days later you begin to recall that same emotion, you'll see that you will be able to recall more of that emotion in terms of more intensity without breaking, just like building a muscle. And pretty soon, that trauma over time, depending on the depth of and pain of that trauma over time, will not have as much of an impact on you. And that's how resilience is built for trauma. Now, of course, this advice does not replace the medical advice that you get from a health professional or something, but this is something on an ongoing basis. For example, as I have experienced separation anxiety because of childhood, and I've recognized that, and I've built my resilience to experiencing that with other relationships around me. So I don't no longer have the same intensity of emotion related to when I think somebody is leaving me or abandoning me or rejecting me. I don't have the same intensity of emotion because I've been able to keep my heart open and practice the techniques that I'm practicing. All right, so there are more advanced level of practices that I do. What we do here are basic level practice. If you want to contact me, I can show you some advanced level practices that will help you really break through this quicker. All right, let us talk about the chi shot moment. Today we're going to talk about the lips. And the lips, amazing how many meridian points we have connected to the lips. We have the pancreas, the spleen, the lymph system, the immune system, the digestive system. And they're all kind of around here. So the way we do this is we warm up our hands, and we place our palm very gently on our lips, like this, pucker our lips, and just circulate them like this around. So make sure that you do that. Circulate this 36 times, circulate it backwards 36 times. And that is your chi shot moment for today. All right, so I hope that helps. Now I want you to take this moment. We're going to go down into this quick coherence technique. This is a basic level technique. Let us try how well this works when you're experiencing a recollection of a traumatic event, an emotion. So feel free to recollect some traumatic event now. And then I want you to practice this technique to see how far, how much you can dampen that impact in your emotional body. All right. So when you've felt that emotion enough and you absorb it enough in your heart, then I want you to place awareness in the area of the heart. We're going to reverse it. We're going to start building this muscle of resilience to trauma. Then we place awareness in the area of the heart, taking slow, deep breaths. Experience these breaths flowing in and out of your heart. And just take very slow, very deep, very gentle breaths. When an emotional memory comes in and you start feeling it, your heart starts palpitating. What we want to do is be conscious and take slow, deep breaths. And as you breathe them through your heart and you visualize them flowing in your heart, your heart begins to beat very more balanced, in a very more balanced fashion, which means that what it'll do is it'll bring your autonomic nervous system into balance. And you're mechanically modulating your autonomic nervous system, which then controls 90% of all the automatic functions in your body. So by taking the first two steps, you are creating some amazing benefits for your body. You are building that emotional resilience, the trauma resilience. So let us keep these slow, deep breaths and experience this flowing in and out of your heart. And now the third step is to experience gratitude. There was something in that trauma that you are thankful for that came out of it. Whatever that was, find that point of gratitude, that appreciation. Was somebody there to support you after? Were there circumstances that made you feel better? In my instance, I had my grandmother who gave me a lot of hugs. And my grandfather was there to support me as well. So that is the gratitude I feel. And let's focus on that aspect of the experience. And we will replace this traumatic situation. So take slow, deep, gentle breaths. Experience those breaths flowing in and out of your heart. And then start feeling gratitude. And the higher the intensity of your feeling, the deeper and the more fortified your resilience. So then ask your body, I want to feel a more intense version of gratitude. Wonderful. Thank you so much for joining me this morning. Uh, and I hope your week is off to a wonderful start. I hope you'll practice these techniques when you experience a recollection of an emotional situation, whether it's, whatever that is from childhood or it just happened yesterday. And I hope you'll practice this in this way. While you're typing in your questions, because now it's Q&A time, while you're typing in your question, just wanted to let you know that I'll be doing a live session next Saturday this coming Saturday at 9 o'clock in the morning Mountain Time. And it's going to be optimal performance under pressure. One of the things I did mention to you earlier today, or just at the beginning, is that as soon as you place your awareness in the area of the heart, your stress levels go down. And there's scientific evidence for that. And I want to share with people a paper that was written in 2018. And it was by an independent from HeartMath. But this was, they actually used some of the HeartMath system. And I want to share with you, as soon as you place your awareness in the area of the heart, you'll see the stress levels improve. And then when you take slow, deep, gentle breaths, they improve even more. And then, when you begin to feel the emotions, the stress levels are just amazing. They drop completely. And it doesn't take long. And these studies have shown to do that. I want to share the body of evidence. I want us to practice some of the techniques that I'm going to bring forward. Usually we use advanced techniques in this particular presentation. So hopefully that you can join us. If you are an Ignite member, this is all included in your membership. If you're not, you can purchase this a one-time event for $15, and you can get replay for 30 days after. Okay. All right. Q&A time. Let's Q&A. Hello, Dil. You're on a retreat today. Well, wonderful. Thank you so much for joining this morning. I hope you're having a wonderful retreat. I hope things are going well in the UK for you. Things are a little dicey there, I'm sure. Amber Meliha Wolf, question. With the ongoing trauma of COVID, is there a particular technique that will help us for daily practice? Yeah, that's a good question, Sister Gia. That's a very good question. One of the things that, when we talk about trauma, because we only have 15 minutes in this program, we don't go into specific types of trauma. So, people during COVID, we're thinking COVID situation is creating trauma. I don't believe that's the case. I think what it is the COVID situation is making us, all the trauma that we have been suppressing, bringing that back up for clearing. Now, there may be if there's a trauma that happened in the COVID situation, for example, I walk into a restaurant, I don't have my mask, and then the security guards attack me. Okay, that's trauma caused by COVID. I get that. But most of the trauma, given my read of what's going on, is not caused by the COVID situation. It's brought up to the surface, and COVID is a catalyst for it. And I think we need to make that distinction. We really need to make that distinction, because the type of trauma that's worth addressing, to pay attention to and really delve deep into, is the type of trauma that's been sitting with us for such a long time, and they've been repeating patterns that we haven't resolved. And that is the one that creates a deep groove in our psyche that it keeps repeating. For me, I'll give you an example of a trauma that was amplified during COVID. And that trauma was, my childhood, the separation anxiety. So exactly what happened to me was, as a child, I was sent away to study in a different country from my parents. And in doing so, of course, I was 5 years old. I didn't have any rational thinking process. All I experienced was abandonment and rejection. Now, I had a lot of loving people around me, but to a child, that's something that, it's a child. I'm a child. I was a child. And when that deep groove happened for me, as I was growing up, I never really had very strong, deep relationships with friends, because I would always pull back. I would always stay away. Whenever they would invite me out and to get to know me better, I would always have this barrier in front of me. And I had no idea, and I was doing this for more than a decade. I had no idea. When certain situations hit, like COVID, okay, all of a sudden, now I've had to face this anxiety. I've had to face this separation even more. And so it comes up again. So this was my childhood thing amplified by COVID, catalyzed by COVID. But at this point in time, I had enough tools by now to actually dive deep in and ask the questions. And this is a whole process. If you want to resolve an emotional trauma that is really worth resolving, not just the one that I got kicked out of the superstore for not wearing masks, that may not be a repeating pattern. You may get over that very quickly by using these techniques. You just use the techniques we have here when you have that trauma. But when you have this childhood trauma that's repeating and you realize and recognize there's a repeating pattern here, this is the one that it's worthwhile resolving. And I was able to do that very recently. I actually did an espresso shot on this a couple of weeks ago, if I recall correctly. And basically the technique I used was whenever I felt a sense of rejection or an impending sense of rejection from another person, I kept my heart open. And I actually absorbed enough of that rejection experience enough to say, okay, now this is enough. It's like I was doing the repetition and all that of the weights, and then I said, okay, I can't do it anymore. And the coach beside you says, no, one more, come on. And the coach helps you. That's the kind of stuff that I did. I brought it in, and then I said, okay, enough. And then I started experiencing love and gratitude. And when that happened, I actually got rejected by that other person. I actually felt abandoned and rejected. But when that happened, I didn't feel the traumatic experience that I would have felt if I hadn't done this practice. So really, that's a long-winded answer to your question, Dr. Wolf. But that is essentially my experience in experiencing trauma during COVID. They're really amplification of what is going on in our life in the past that are repeating patterns. All right. Dearest Dill, learn doing this with kindness and mindfulness, using it like how you use gratitude. It worked too, like regenerative feelings like compassion, care, appreciation, and gratitude. Amazing when you connect with the heart. Absolutely. Dr. Wolf, perfect point. Thank you. You're most welcome. You're most welcome. Yes, thank you, Dill. Loving kindness. Zachary, thank you so much. Loving to you too. Thanks for joining us, Zachary. Appreciate that. All right, no more comments or questions are coming through. So we're going to say thank you for now. Thank you so much for joining me, and I look forward to seeing you next Monday. If you want to join me for the Optimal Performance webinar coming up, then check out your email and you'll see a link to it. All right, take care. Thank you so much.